Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, management of the cataract. So, in the management of cataract, first, number one, there is no role of medical therapy in the management of cataract. Mainly, surgeries are important for the management of cataract. Now, surgeries for cataract mainly depends upon either it is a congenital cataract or it is an acquired cataract. Then, in the congenital cataract or acquired cataract, in the congenital cataract, we can give the patient um, mydriatics and optical iridectomy is done for stationary central cataract. For stationary central cataract, we give mydriatics and also we do a optical iridectomy is done. Whereas actually the treatment of choice, if you were asked, this is actually the treatment of choice where we do a posterior capsulotomy is done along with the lens aspiration, and primary posterior capsulotomy with anterior vitrectomy is done for the congenital cataract. So we do a lens aspiration with primary posterior capsulotomy. That means if this is the capsule, this is the lens is surrounded by a capsule, okay, and this is the eye. Okay, number one, we do cut the capsule and enter the lens, and we do aspiration of the whole lens matter, and we also do the anterior vitrectomy is also done in these patients. Actually, if you do not do anterior vitrectomy in congenital cataract, then the patient might develop a recurrence of the cataract can occur due to the opacification of the vitreous, anterior vitreous. So even anterior vitreous is also removed for that reason. Then we have acquired cataract. In the acquired cataract, we have intracapsular cataract extraction is seen. Then we have extracapsular cataract extraction, small incision cataract surgery is seen, and phacoemulsification can be done. So actually right now we mainly do the phacoemulsification and small incision cataract surgery are mainly done in the present days. Intracapsular and extracapsular cataract extraction are not done nowadays.
thank you and thank you for watching.